Access to cancer treatment is important because it increases cancer survivorship and reduces the burden on families and cancer patients. I am Susan Africa Manican, the wife of the late great actor Spanky Manican. As caregiver, I held Spanky's hand throughout the physical, financial, and emotional challenges of the cancer patient journey. Being a cancer patient caregiver is very challenging. But believe me when I say, may pag-asa pa at may magagawa ka pa laban sa cancer. Hope from Within is an advocacy that promotes cancer awareness, better access to new treatment options, and hope for survival for all patients. The Philippine Society of Medical Oncology currently has ongoing efforts to push for better access to more responsive and affordable healthcare services for cancer. Join us in advocating for equitable, affordable, and timely cancer care services. You can sign the petition by visiting the link below. To know more about the advocacy and want to be part of a community that aims to renew hope and optimism for the thousands of cancer patients and survivors, follow Hope from Within's Facebook page at Hope from Within PH or visit hopefromwithin.org.
Access to cancer treatment is important because it increases cancer survivorship and it reduces the burden on families and cancer patients as well. I am Tirso Cruz III, and I am an ambassador of Hope from Within. And by God's grace, I am a lung cancer survivor. The Philippine Society of Medical Oncology currently has ongoing efforts to push for better access to more responsive and affordable health care services for cancer. Join us in advocating for equitable, affordable, and timely care for cancer services. You can sign the petition by visiting the link below. And if you want to know more about the advocacy and want to be part of a community that aims to renew hope and optimism for thousands of cancer patients and survivors, follow Hope from Within's Facebook page at Hope from Within PH or visit their website, hopefromwithin.org.
Do these soundbites sound familiar? Where's the proposal? The meeting's tomorrow already. Sorry for the rush, but please make a presentation at the end of the day. When things are going too fast, take a coffee break to reassess, recharge, and rebound. In fact, catch up with the Manila Times Coffee Break. This is a refreshing time out with our experts who will chat with us about the steaming topics on the lips of consumers. Experience the perks of the coffee break here on the Manila Times Facebook page. Hello and welcome to the Manila Times Coffee Break. Today we'll be discussing about Hope from Within. This is a multi-stakeholder cancer advocacy organized by Merck Sharp and Dome Philippines or MSD Philippines, which aims to raise awareness and strengthen the fight against the disease by facilitating positive and hopeful conversations, promoting early testing and access to cancer treatments. And because of the COVID-19 pandemic, we all know that there is a problem right now with cancer patients going to the hospital because they are immunocompromised. And how do cancer patients and their carers should be given the care that they need despite the ongoing pandemic that is COVID-19? And to give us all the information that we would like to hear and share is our guest for today. She is the chief of the research committee of the Philippine Society for Medical Oncology. She is also currently affiliated with the Asian Hospital and Medical Center and De La Salle University Medical Center. Again, ladies and gentlemen, please say a warm welcome to our coffee break guest, Dr. Mary Ondinee Igot.
Good afternoon, Sir Ed. Good
Yes,
afternoon.
good afternoon. So, of course, cancer, it's a very, very touchy subject in my end personally because my mother died of cancer 2 years ago. So, I know it's hard for our cancer patients to venture right now because of the COVID-19 pandemic. So, how are we going to how are we going to allow our patients to go into hospitals to do their own checks or checkups, especially that we are in a COVID-19 pandemic.
Okay. So it's actually not just the cancer patients who are afraid of COVID, but basically everyone. So it's a universal fear, which is among us people. But here in the Philippines, or actually even in the other parts of the world, I don't think that cancer care really stopped in most cancer centers. I think there was just a time when the cancer centers, they closed or they slowed down a bit, but this was actually just to prepare the
Mm-hmm.
unit and the hospital staff to procure more personal protective equipments for them and to install possibly more air filters, do some terminal cleaning. But basically, cancer care did not really stop.
Mm-hmm.
And uh, in that area also, we encourage cancer patients to still go to their doctors and to still get their treatments because cancer care should really be a continuous treatment because if you stop your cancer treatment, there might be a chance wherein your early stage cancer can metastasize or even go worse. And if that happens, our window as oncologists to treat patients or possibly to cure them, it can be lost if those patients will be lost to follow up.
Mm-hmm. So you said that cancer care did not stop during the pandemic. So what are the different measures that the hospitals have already implemented, especially now that we are in a pandemic, and we know that people are scared to go to hospital. So how can cancer patients be able to go to their hospital to check themselves up?
Okay. So for most hospitals, the cancer center is actually a protected unit. Okay. Most of the time, it's really far from the emergency room or from patients who are infectious. Okay. Especially in cancer institute, a standalone unit, and shifting also this kind of technique so that the cancer care can really be protected. So for example, in my hospital, there's a separate unit, so there's a separate building catering to cancer patients. But protocols, I think, will really differ from one hospital to another, and it also will differ. For example, if your hospital is situated within the heart of the pandemic, or is it in an area wherein there are less people who are COVID patients? It will also depend also on the hospital. For example, if you get your chemotherapy in a cancer center, some hospitals will require that you test negative first for
Mm-hmm.
the COVID. So they will require a swab test, which will be effective for it differs. Some hospitals they honor 5 days. Some hospitals they honor it 7 days, or some hospitals they honor it for 14 days. Other
Mm-hmm.
hospitals are not so strict. Like they still give chemotherapy for patients provided that there are no symptoms. But I think what is universal now in all of the cancer centers is that the healthcare workers are protected. So most cancer centers that I know, they wear already level 3 PPE or personal protective equipment, and they require all cancer patients to wear a face mask and a face shield. And we have limited the number of people going inside into our unit. Like for example, for one cancer patient, there will only be one companion or one bantay. And in some hospitals, they don't allow patients to eat inside the cancer center because they have to remove their masks, and we don't want that to happen for the patients because they might get exposed to the ambient air, which might be carrying the coronavirus. So most of the time we really encourage the patients not to remove their masks.
Mhm. And you said about testing. So, of course, there are so many testing methods, but you are saying explicitly that doctors should be require most cancer centers should require swab tests, not rapid tests.
Okay. The Department of Health has issued their own position statement that
Mm-hmm.
rapid tests for now should not really be used to
Mm-hmm.
screen patients. Okay, so that one is really what do you call this standard. But
Mm-hmm.
for different cancer centers, I think it really depends on the hospital policy or the cancer center policy if they would require a COVID swab. But for most of the cancer centers that I know, they will require already a negative COVID RT-PCR swab test, not a rapid test, prior to administering the chemotherapy for a patient.
Mm-hmm. And of course, now that you mentioned about chemotherapy, were there any changes in the protocols of chemotherapy, especially especially now that we all know chemotherapy can destroy the immune system to the cancer patient. We all know it debilitates the immune system of the patient. So do we have any changes in, should we say, chemotherapy protocols for cancer patients, especially during the COVID pandemic?
Okay. During the start of the pandemic, since there was still a lot of unknowns, so we modified some of the chemotherapy protocols into just using oral chemotherapy
Mm-hmm.
treatments. But now that we have more evidence, we know more about the disease, we are shifting back to the usual treatment protocols for cancer patients because these protocols are the ones which have the most evidence. Okay, we just emphasize strict physical distancing measures. You should always use the alcohol-based hand rubs. But for most part, I think that uh, the treatments that we have been using even before the pandemic can now be used because the chemotherapy units are actually cleaner now. There are more stricter measures to control the spread of COVID. So I don't think there will really be a change in the cancer management. What I do notice now is that, which is also released in one of the journals, that we should be liberal now into using boosters for white blood cell, especially if you think that your patient will not do well and the white blood cell count might go down. You might be more liberal in using those kinds of boosters.
Mm-hmm. Doc, I know, um, I know there are people who are scared to go to the hospitals right now because of the pandemic. In your case, does your patients have already told you that I'm scared to go to the hospital right now? I'll just skip my treatment right now, or are there any other options for treating cancer during this pandemic? Do you have any experiences from your patients like that?
Okay, so we are now actually on our 7th month into the pandemic. So during the first part of the pandemic, a lot of my patients really didn't want their cancer treatments to be administered to them because of fear of going inside the hospital. But I also tell them that we really don't know when this pandemic will end. Okay, because that's what they wanted. They wanted to go back into the hospital when the pandemic is done or when there is no more COVID. But I tell them, we don't know when this will stop. So if it will stop in 2 years, will you have your cancer treatment after 2 years? And this actually makes them think that they really need their cancer treatments right now. And as I mentioned earlier, people are now more confident because we know already how the disease works. We are already equipped with more face masks and face shields because earlier in the pandemic there was really a shortage of the masks, and a lot of people were hoarding them. But now that they are in a better supply and more patients will actually have more access to them, they're more confident now to go into the hospital. And I think it also the hospital also plays a role in this one, because if they see that the hospital has very strict protocols, then it brings back to the patient their confidence to have their treatment in the hospital. And I think most hospitals now, they're cleaner, they really have more stricter protocols. So I think that will help the patients not to invite them back to their treatments.
Mhm. Of course, people are right now scared of getting COVID-19, but of course, people are more scared of getting cancer and COVID-19. So, um, how is the how do you what is your opinion on people um getting getting scared of COVID-19, but they should be more scared right now because cancer is one of the leading causes of death in the Philippines, one of the leading causes of death in the Philippines. And people right now are scared to go test themselves for go early detection to their cancer, but they are more scared of COVID-19 than cancer. I mean, we all know that cancer is a very is a silent killer in some cases. What can what can you say about it?
Okay. So again, earlier in the pandemic, we were the screening for cancer patients were actually in the lowest priority. But now, because we're already on the seventh month of the pandemic,
Mm-hmm.
and I think now is actually a good time to have yourself screened, not to delay your cancer screening, because now again, hospitals have stricter protocols. You can avail already of all of the diagnostic treatments, because the services in the hospital, all of them are available
Mm-hmm.
already. Okay, before kasi in the pandemic, like colonoscopy was not yet done, and the CT scans were only limited to those patients who were really symptomatic. But now, a lot of hospitals actually bought two CT scans already, one for COVID patients and one for non-COVID patients. So I think that people now should really be more comfortable in going into the hospital to have their cancer screening, cancer treatment, their biopsies. Because if you wait a little bit more, there might be a chance that your cancer might spread or it might develop metastasis.
Mm-hmm. And of course, let us get ourselves reoriented with the cancer. What are the risks? There are different cancers, right? Of course, and there are different risk factors involved in cancer. But what are the most common risk factors in most cancers? Like for example, we all know that what are the most important risk factors in most cancers, so that our audience may know uh, what food or should they avoid, what should they avoid doing.
Okay, so I think we have to discuss. There are a lot of risk factors, but some of these risk factors will not be modifiable. Okay,
Mm-hmm.
so maybe we will talk about those things that we can change or those things that we can modify. So first thing will be smoking. Okay, so we all know that smoking is bad. It causes cardiovascular diseases. It causes lung cancer. And actually, patients who smoke, they fare much worse when they develop COVID. So actually, that one should be really be removed from all patients. No smoking. Another one which is modifiable will be alcohol drinking. Okay, so if at all, if you have to drink alcohol, you have to do it in moderate amounts, no, because alcohol can lead to cancers of the gastrointestinal tract, liver cancers. Another thing which I think is overlooked will be being overweight or being obese. Okay, so there are a lot of studies already linking obesity with a lot of cancers like breast cancers, colon cancers. Okay, because when you are obese, you have a lot of growth factors, and these growth factors also they make your cancers grow. Okay, so I think obesity should really be placed into a minimum, because it will also help those patients with heart problems, with diabetes, with stroke. So I think we really have keep our body weight into the normal range. Okay, so smoking, alcohol, and your body weight. Those are the top three modifiable risk factors that I think we can modify.
Mhm. Doc, right now there is a new thing called telemedicine, and we all know that telemedicine has been very much helpful, especially during this pandemic. How can telemedicine help cancer patients in their treatment? I mean, we all know that cancer patients should be come to the hospital more personally because the treatment should be more more personal. But how can telemedicine help cancer patients in their treatment?
Okay. So telemedicine or teleoncology, to be more specific, is actually defined as the delivery of clinical oncology services via audio, so they can just
Mhm.
call you, or via a video communication technology to patients who are not, to patients who are at a distance. Actually, even before the pandemic, I think a lot of doctors are using this telemedicine already because some patients they text us or they call us. But now I think it has become a mainstream way so that patients who are inside their houses, they can communicate with doctors.
Mhm.
Personally, I've been using telemedicine since late May, and I think it's very useful because there's still the fear of going into the hospital. And for simple questions or simple problems that the patients might face, they can just communicate with their doctor. They can show them the part that is affected. Actually, you can see anything in the video conference. I've also have a lot of experience guiding the patients
Mhm.
on what to do next. Like, for example, they have a mass, but they are not within my area of locality. So I guide them that the first thing that you have to do is go to a surgeon, ask for a biopsy, and then I can guide them because some of the clinics are physically still closed. And then this has also been very important for my patients who need prescriptions for their maintenance medicines like pain medicines. Okay, some of the patients cannot really come to the hospital because they're in so much pain. So I use telemedicine or Viber or Messenger so that I can give them their medicines, their morphine prescriptions, their oxycodone prescriptions, and their other maintenance prescriptions like for hypertension. And I can also use telemedicine to do surveillance for my patients who have completed their treatments. Like I can give them a request for a chest CT scan, and then they can just send me the results. And if there's nothing wrong with them, then I can just do another telemedicine after 3 months and not really see them physically because I think it's really the same. What I do not recommend though for telemedicine will be for patients who have a lot of complaints and who I think might need emergency services. So
Mhm.
for those kinds of patients, I tell them that I cannot use telemedicine for a consult, and then I direct them to the emergency room so that their problems can be immediately addressed.
And how are the patients assured of their privacy and their confidentiality when using telemedicine?
Okay, so I give them an informed consent form. I tell them that this is an it's just a patient to a doctor relationship, no. So everything will be placed in safekeeping, and then I will not post anything. And most of the patients, they agree to the telemedicine with that after seeing the informed consent already.
Mhm. Of course, aside from your saying that you don't really consult much whenever there's an emergency case, do you ever experience problems like, for example, internet problems? I mean, that's a big problem in telemedicine. I mean, you need connectivity to the internet.
Yes, so I think that's really a major problem for telemedicine because the doctor and the patient himself need a very good connection so that the ease of the conversation will be very fast. So for those patients, in my experience, I really just have to be patient with them. okay, because they want my services and I really also want to give them my service. So if I cannot really use the video conference platform, then I just call them and just tell them that unfortunately your internet connection is not that good, but I will try to help you via a phone call. So I can still give them, I can still text them, I can still call them, because these patients want your help. And so I really try my best to deliver the service to them,
Mhm.
despite of the internet problems.
Mhm. Doc, what is your take on chemotherapy at home? Is it advisable for cancer patients to do their own to hold chemotherapy sessions in their home? I mean, are there any studies or recommendations made about doing chemotherapy at home as in lieu of going to the hospital instead?
Okay, so there are some chemotherapy protocols that are really designed to be administered at home. Okay, so these will be the oral cancer treatments. For these cancer patients, we don't really need to see them very often. We just need to see them every 21 days or every month, and then they just present us with laboratories. A large part of my telemedicine is actually catering to these patients who are just on oral tablets. So it will remove their need of going physically to me just so that I can do a physical examination for them. So whenever I see them that they look well and their laboratories are well, I allow them already to go into their next cycle of oral cancer treatments. But the cancer treatments which are administered via an intravenous route, we really don't recommend it being administered at home, because you need a chemotherapy nurse and a doctor to supervise the infusion reactions or the side effects of the treatment. But we do have patients who continue their cancer treatments at home if they are on tablets.
Mhm. And of course, right now, how important is early detection in cancer treatments? I mean, um, we all some people would want to detect forego their cancer checkups, or they feel some symptoms already, but they forego it because they think that's just only an anomaly in their body. So how important is early detection in cancer treatments? I mean, we all know that there are people scared of getting cancer because they feel it's a death sentence from them. So, how do people should be assured that having cancer is not a death sentence for them? It is treatable. It is preventable. And how can you? How do you assure your patients that we are there for you? Medical professionals will be there for you.
Okay, so actually the best is really if we get the patients at their early stages. Sometimes there's a stage 0 or a pre-malignant phase of the cancer. This is the best subset of patients that we want to catch. Okay, because their cancer is not yet there, and if we remove the precancerous disease, they'll be basically be cured. Okay, but for some of the other patients, like stage 1 or stage 2, still a lot of them will be cured. So that's actually the importance, that if you feel something already in your body, like there's a mass, it's important that you go immediately to your doctor so that you can have this treated. But for some patients, like there's no mass that can be palpated, and then these patients will present already with a stage 4 or an advanced stage of cancer. Cancer, again, is not necessarily a death sentence already because of science. Okay, we have so many innovations already because of science. And because of that, we have been helping more patients live the lives that they want to lead. Okay, even if stage 4 or even if they're in their advanced stages, a lot of patients can live beyond 1 year, can live beyond 2 years, sometimes even live beyond 5 to 10 years. And this is because of the science that goes into making all of these cancer treatments available to the public.
Um, of course, being a part of the Philippine Society of Medical Oncologists, has our cancer care system radically improved, or did it change during the pandemic?
Okay, so again, it will go into what phase of the COVID pandemic
Mhm.
you're talking about. I think
Mhm.
during the first few months, the first 2 to 3 months, patients really didn't want to go to the hospital, and sometimes even the doctors, they're not there because they're afraid and they did not have the personal protective equipment yet because there was a shortage. But now, I think cancer care has really normalized already. Okay, more patients are actually more comfortable in going to their hospitals, and I see now a lot of patients who have been inside their houses with growing masses, malalaking bukol, no,
Wow.
they now go to the hospitals seeking for treatment. So I guess in the next few months we will be seeing more cancer patients who have kept themselves inside their houses for the past few months.
Mhm. Doc, of course, people are now scared of cancer, and of course, it's have been aggravated by COVID-19. So, as a final parting message, Doc, how can we be assured, or how can the cancer patients and their carers be assured that health practitioners will be there for them to comfort them, especially during the COVID-19 pandemic?
Okay. So most hospitals, their cancer centers are really open. So for those hospitals without any cancer centers, you can actually ask the hospital administration or the HR if there are cancer doctors already doing their practice. But for most part, because we have our own connection of medical oncologists, I think majority are really practicing already. So it's actually just up to the patient to seek for our help, to go to the hospital and get the help that they need. Okay, now I think that it will be a bit harder for them to get appointments because everything really has to be scheduled so that there won't be any crowding in the clinic hallways. But physical clinics is not just the only option now. So aside from that, you can also do virtual consultations via oncologists who have adapted this in their personal practice. So I think there's really no excuse not to get the cancer treatment that you need even during the COVID pandemic because you have two options: go to the hospital or go online and find a doctor. You can just look it up in the internet. There are a lot of platforms already catering to virtual consultations. Actually, for any problem like for cardio, pulmo, everything it's there in the internet. It's just up to you to go get yourself the treatment that you want. Okay, as a parting word also, cancer care should not stop. Okay, so go get your cancer treatment. The cancer centers, the oncology units, they're open. They're ready to serve you. You have to trust your doctors. You also have to respect and you have to follow hospital protocols because it's for your protection. And aside from that, you also have to protect yourself, protect your family because we don't really know what the duration of this COVID pandemic is. But now we are more equipped, we're more ready to accept more patients so that cancer patients will not have delays in their treatment.
Estimable words. Thank you very much, Dr. Igot. That was Dr. Mary Ondinee Igot of the Philippine Society of Medical Oncologists, gracing the Manila Times Coffee Break. And Hope from Within is about putting the Filipino cancer patient at the center and giving them a platform to share their story with a stronger voice. And more importantly, a stronger fight to overcome the disease. It's about the community of decision makers, influencers, and supporters coming together to build a better support system. If you are a cancer patient and you would want to share your experience and share your story with other fellow cancer patients, you can be a part of the Hope from Within community. You can get up-to-date information, patient journey maps, and also resources from the PSMO. You can follow Hope from Within's Facebook page at facebook.com/Hope from Within PH. Again, that's facebook.com/Hope from Within PH. There is also a lung cancer group, resource group for lung cancer sufferers. That's bit.ly/Hope for Lung Group. You can also visit the Hope from Within website at hopefromwithin.org. This is Red Mendoza, the Manila Times health reporter. I hope you had a great time today enjoying this coffee break with the Manila Times today. Have a great coffee break and see you again soon.
Access to cancer treatment is important because it increases cancer survivorship and reduces the burden on families and cancer patients. I am Susan Africa Manican, the wife of the late great actor Spanky Manican. As caregiver, I held Spanky's hand throughout the physical, financial, and emotional challenges of the cancer patient journey. Being a cancer patient caregiver is very challenging. But believe me when I say, may pag-asa pa at may magagawa ka pa laban sa cancer. Hope from Within is an advocacy that promotes cancer awareness, better access to new treatment options, and hope for survival for all patients. The Philippine Society of Medical Oncology currently has ongoing efforts to push for better access to more responsive and affordable healthcare services for cancer. Join us in advocating for equitable, affordable, and timely cancer care services. You can sign the petition by visiting the link below. To know more about the advocacy and want to be part of a community that aims to renew hope and optimism for the thousands of cancer patients and survivors, follow Hope from Within's Facebook page at Hope from Within PH or visit hopefromwithin.org.
Access to cancer treatment is important because it increases cancer survivorship and it reduces the burden on families and cancer patients as well. I am Tirso Cruz III, and I am an ambassador of Hope from Within. And by God's grace, I am a lung cancer survivor. The Philippine Society of Medical Oncology currently has ongoing efforts to push for better access to more responsive and affordable health care services for cancer. Join us in advocating for equitable, affordable, and timely care for cancer services. You can sign the petition by visiting the link below. And if you want to know more about the advocacy and want to be part of a community that aims to renew hope and optimism for thousands of cancer patients and survivors, follow Hope from Within's Facebook page at Hope from Within PH or visit their website, hopefromwithin.org.